Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. Millions of people worldwide are currently impacted by heart valve disease, and 1 in 8 people aged 75 or older have the most common form, that's aortic stenosis or AS. Now, currently, treatment options for AS include transcatheter aortic valve replacement or TAVR. It's a minimally invasive procedure, or surgical aortic valve replacement, also known as open heart surgery. Well, joining us here on Health Professional Radio is Dr. Purvi Parwani. She's Director of Women's Cardiovascular Health Clinic at Loma International Heart Institute. She's joining us this evening to talk about some new findings from a CardioSurve survey sponsored by Medtronic and conducted by the American College of Cardiology. Welcome to Health Professional Radio, Dr. Parwani.
Thank you so much, Neil. So excited to be here and discussing this very topic that is close to my heart with all of you.
Now, you are director of the Women's Cardiovascular Health Clinic there at Loma Linda International Heart Institute. Give us a small look into your professional background, and then let's talk about what the ACC CardioSurve panelist survey was and why it was distributed.
Yeah, thank you. So I'm a non-invasive cardiologist. What that means is I did general cardiology fellowship and went on further to do cardiac imaging to figure out, how exactly we can diagnose these valvular heart condition. So I take care of a lot of patients with valvular heart disease, and I predominantly focus on women in my clinical practice, since women can have some gender-based differences. So talking about the ACC CardioSurve panelist survey, so that was sponsored by Medtronic, as you correctly pointed out, and conducted by the American College of Cardiology, and it gathered responses from around 150 cardiologists. And what we were interested in looking at are the key factors that were driving the treatment choices for patients that are presenting with symptomatic severe aortic stenosis. And this was further published in the ACC Cardiology magazine this year in April. But basically the purpose of the survey was to learn about the attitude of shared decision making amongst the cardiologists that are working with patients that come with aortic stenosis. And the fun part about this was that this survey was paralleled with the active living survey that was published by a patient advocacy group called heartvalvesurgery.com. So they gathered data from, almost 3,400 patients and their caregivers, kind of facing the same condition. So we had a really rich amount of data from both physicians and patients. And what it really showed was how both physicians and patients want to improve the doctor-patient dialogue to help create really an individualized treatment plan.
So what exactly is AS or aortic stenosis, and what are the common treatment options that are currently available for those patients?
That's a great question, Neil. I'm so glad you asked that. Aortic stenosis is a valvular condition. So aortic valve is the valve that that connects our heart chamber, the main heart chamber called left ventricle, to the outside world, to the rest of the body through this pipe called aorta. So the aortic valve is situated between the aorta and the left ventricle. And most commonly due to age-related degeneration, this valve that is beating, almost more than 60 times a minute, throughout our life, kind of gets degenerated and develops this condition called aortic stenosis, which is basically tightening of this valve. So more than 5 million Americans, in general, get infected by the heart valve disease. And almost 1.5 million have the most common form of aortic stenosis. And when you started, you mentioned the treatment options. So the treatment option roughly are the surgical aortic valve replacement, which is more invasive open heart surgery, or the minimally invasive procedures that are called the TAVR or the transcatheter aortic valve replacement.
Now, you mentioned age-related causes of the stiffening of this valve. Are there other causes of AS in younger people or non-age-related causes?
Yes, of course. That's a great question. So this valve typically has 3 doors in common words, and we call it a tri-leaflet valve. And due to a congenital condition called bicuspid aortic valve, some people are born with 2 doors instead of 3 doors. And you can imagine, when you have less leaflets or less doors, the blood, goes through a limited opening. And so young patients that are born with bicuspid aortic valve can develop aortic stenosis at an earlier age, although the most common form of aortic stenosis would be in the older population, predominantly due to age-related degeneration.
Well, what would you say were the main takeaways from the survey, a few of the highlights, if you will?
Yeah. So I think the survey, really indicated that the physician recognized the importance of the shared decision making to achieve the individualized care for the patients that are suffering with the heart valve disease, particularly with aortic stenosis. So nearly 75% of the cardiologists said that they treat aortic stenosis patients, and when they treat these patients, they discuss the treatment options with their patients at the time of the diagnosis. Almost half of them said that, symptomatic patients with aortic stenosis diagnosis are not as informed as they should be about their condition and their treatment options. And almost, again, half of the cardiologists, or more than half of the cardiologists, believe that if we can prep our patients, bring the family members to attend a meeting or give the audio-visual guide, educational material to our patients, it may lead to better quality discussion around the treatment options for heart valve disease, in this case, aortic stenosis. Now, the active living patient survey that I was telling you about found that, patients think that the highest factor in determining their treatment option was that doctor-patient dialogue. So that's the most important thing. And almost 90% of the respondents who said that they were, patients, they said that they are influenced by the conversations, by this dialogue that they have with their doctors. But again, almost 1/3 thought that they could have asked more questions, during their doctor's appointment. So patients thought that they ought to be more prepared. Doctors also thought that patient could have been more prepared. But almost everyone agreed that this dialogue was the most important thing in this survey.
Did it discuss why that dialogue wasn't taking place in the first place?
75% of the physicians or cardiologists said that they were, they were discussing, the treatment options with patients regularly. I think that, they did not dive into what are the barriers, but they did, surveyed the cardiologists, and the cardiologists, I think more than half of them agreed that if we can prep our patients with some sort of educational audiovisual material, or maybe have a younger family member or someone attend the visit, take the notes, and then, ask the appropriate questions, that would be helpful to our patients in guiding, to make the decisions around their heart valve disease.
Is there anything that you'd like to add, Dr. Parwani, for our listeners?
So I think that what this survey told us was, in clinical practice, we are seeing more and more cardiologists having a shared decision and shared discussion with the patients when making, the treatment options. And in my opinion, this really, align the goal of the physicians and the patients, because physicians are worried about patient mortality, and the patients are worried about how they can get back to their active lifestyle. So I think by having shared decision making, we truly can align these goals while we are making, these treatment decisions for our patients.
Dr. Parwani, it's been a pleasure speaking with you. I appreciate you joining us here on Health Professional Radio. Thank you so much.
Thank you for inviting me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Purvi Parwani, Director of Women's Cardiovascular Health Clinic at Loma International Heart Institute. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.